Okay, so on the right, I have a picture of one slice or a slice of a brain on depression and one that's not depressed. Now, you don't have to be a radiologist, you don't have to be a neuroscientist to look at this and say that the two look very different. That the non-depressed one has a lot of activity or a lot of yellow and orange, and that the depressed one lacks a lot of activity or has more blue, lack of activity, and less yellow. So depression is associated with a reduction of brain activity in certain areas, and in fact, an increase in activity in other areas. So if we go on to the next slide on brain anatomy of the depressed brain, we see that there are brain changes that happen with depression. You have increased blood flow or increased activation in areas that are emotional, that have to do with emotion. For example, the amygdala, that mediates fear. But at the same time, you have a decrement of blood flow or a decrease in activity in areas that are important for thinking, decision, and attention. And also your cortex, the outer wrinkly part of the brain, on the right hemisphere is much thinner compared to the left hemisphere. In fact, happy mood is related to increased activation and blood flow to the left regions of the brain versus the right. And that most people with depression show increased activity in the right prefrontal cortex and decreased activity in the left. So this led to a hypothesis called the right hemisphere dominance of depression, indicating that people who are depressed are either born with, well, we don't know what comes first, increased activity in the right hemisphere, which predisposes them to depression, versus people who are not depressed. And because the brain controls the opposite side, so the right hemisphere controls the left hemisphere, and the right hemisphere controls the left side of the body, and the left hemisphere controls the right side of the body, most depressed individuals will gaze to the left, meaning that the right hemisphere is dominant during a verbal task, while non-depressed people will gaze to the right, meaning a left hemisphere dominant during a verbal task. Also, people who are depressed have difficulties regulating their stress hormones, and we'll talk about that more in a couple more slides. So if we can go on to the next slide. Okay, there's also another chemical in the brain that we think people who suffer from depression have lower than average of. And that chemical is called BDNF, which stands for brain-derived neurotrophic factor. This chemical is really important for nurturing the brain and during the birth of new neurons, which is brain cells, but also maintaining the ones that are alive. So if you don't have enough of that, it's no surprise that some of the neurons or the nerve cells can actually die. This results that in people who are depressed, some studies have shown that they have smaller than average hippocampus. Now, the hippocampus is really important for things like learning and memory. So it's no surprise that people who suffer from depression might also complain of memory problems. We also know that people who use any kind of antidepressant treatment, meaning medication, meaning psychotherapy, whatever it is, that you, when we then look at levels of BDNF in the brain, we see that it actually increases as they get better. Okay, now continuing on with this chemical theme, looking at the, moving forward to the next slide. We have a chemical imbalance in the depressed brain, where you have a reduction of dopamine, norepinephrine, and serotonin. And dopamine is a neurotransmitter or a chemical in the brain that has been implicated in the reward circuit and almost the feel-good or the pleasure center. So it's no surprise if I tell you that the brain that's depressed has lower levels of dopamine. And it's no surprise that one of the major hallmark symptoms of depression is anhedonia, which is lack of pleasure, or they don't find things that typically other people find pleasurable and that they themselves have found pleasurable before the episode, they don't find it fun anymore. The reduction in norepinephrine might also be related to the psychomotor retardation symptom. The reduction in serotonin in the depressed brain might be related to the symptoms of grief, guilt, and pervasiveness. They also have an increase of a substance in the brain called substance P, which is important for pain. So people who are depressed, they're actually in pain. They actually feel pain. In fact, giving them a painkiller medication, any painkiller medication, actually can lead to antidepressant qualities. So depression is truly painful. Okay, so if we move on to the next slide. So we've talked about anatomical differences, we've talked about chemical imbalance in the brain, but we can also talk about another type of imbalance called hormonal imbalance. Hormonal imbalance, we know that, for example, if the thyroid gland is not functioning properly, more specifically if it's underactive, that could lead to depression. In one study, they quote a study saying that 20% of people suffering from depression have an undiagnosed hypothyroidism, so meaning their thyroid is underactive. And also some other evidence for a hormonal imbalance kind of hypothesis or theory of depression is that why is it that women who have different hormones are twice as likely to suffer from depression than males? Why is it that women have highest rates of depression at certain points in their reproductive life? For example, after giving birth, at menopause, and a week or a few days before menstrual cycle. And why is it that the ratio of estrogen to progesterone in females is very important to predisposing them to feelings of depression? So I'm just going to talk about one example to just make sure that the hormonal imbalance hypothesis is well explained, and that is the postpartum depression, which is depression after giving birth. This affects 20% of women. So again, this is on the next slide. If we just advance one more slide. Okay. Postpartum depression affects about 20% of women. However, though, the good news is that most recover quickly, although some don't recover. It is most common in women who have suffered some depression at one time or another. So if you are a female who are thinking about having children and you have suffered from depression, that might be a risk factor for postpartum depression, and you should be prepared for that. It also is associated with a drop in estradiol, kind of estrogen, and progesterone levels. This hormonal fluctuation doesn't just happen in females, it also happens in males as well. So, for example, testosterone drop in men is associated with an increased probability of depression.